Alrighty, this is Healthcare Bill part number 52. We are still on page number 51 of the Healthcare Bill. I know that this is showing page number 74, but the reason for that is because of a reference that's made from page number 51. Okay, so here we go. In subsection C of the special cases thing, we have a double letter I. It's a lowercase double letter I. It says state requirement. If the state requires, in addition to essential health benefits required under section 1323B3A. Okay, now we're talking about an individual state. The individual state is offering this community health insurance option. This would be for people that really couldn't afford much of anything else. Okay. If that particular state requires, in addition to the essential health benefits, now these would be essential health benefits. Remember I talked about in the previous video where you absolutely had to have coverage for ambulance services, you had to have coverage for ER services, that kind of thing. Those are essential health services. Alright? Now, we have to go find section 1323, which we have now found. We have to scroll down a little bit. See a little better letter B right there? Okay, now we have to find the number 3. This is number 1 right here. Okay, this is number 2. See, there's number 2 right there. Aha! Now we have found number 3. And number 3 is essential health benefits. Okay? And we now have to find the great big letter A, which is this one here. Except as provided in subparagraph B, a community health insurance option offered under this section shall provide coverage only for the essential health benefits described in section 1302B. And section 1302B was something we covered in a previous video. So if you want to go back to section 1302, letter B, you're going to see all these essential health coverages. Alright. Now, this community health insurance option is going to give you essential health benefits only. It's not going to give you any extra perks. It's going to cover your ambulance services, your surgical services. It's going to cover your ER services, that kind of thing. Nothing else. This is going to be bare bones insurance. Alright? Alright. If a state requires, in addition to essential health benefits required under section 1323B3A, coverage of services described in subparagraph B1, which is the prohibition of abortions, for enrollees of a community health insurance option offered in such a state, the state shall assure that no funds flowing through or from the community health insurance option and no other federal funds pay or defray the cost of providing coverage of services described in subparagraph B1. Okay? The United States shall not bear the insurance risk for a state's required coverage of services described under subparagraph B1. Now, what did subparagraph B1 say? Abortions for which public funding is prohibited. Okay? So, what it's saying is, if the state says that the community health option has to pay for that abortion, then the federal government will not pay for that abortion. It has to be paid by either the state or by the premiums. Remember, you pay premiums for this insurance. Those premiums would then you use to pay for those abortions. It would not be paid for by U.S. dollars. Okay. Now then, we have to go to the next page where it says exceptions, which is the little number 3. Notwithstanding, then, this subparagraph shall apply to coverage of services described in subparagraph B2 by the community health insurance option. Services described in subparagraph B2 shall be covered by the same extent as such services are covered under Title 19 of the Social Security Act. In my next video, I will show you Section 19 of the Social Security Act, and then we'll go on from there. But there you go. There you have it. We're starting to make sense out of all this. I will tell you more in a future video, so stay tuned.